Overactive bladder is a type of urinary incontinence that involves urgency, frequency, leakages, and nocturia. Urgency means that you experience a sudden and very impulsive need to void your bladder. When this happens, the sensation is overcoming and basically impossible to resist. Frequency means that you pee more often than you used to, and nocturia means that you also start peeing during the night. Overactive bladder is a symptom syndrome which can be explained by overactive nerves in the bladder. This is very simply the women's anatomy. We have the vagina, the uterus, the bladder, and the urethra. The problem is, simplified, that the nerves entering the bladder are overactive. These nerves start firing too many electrical impulses, and the bladder, which is a big muscle, reacts by contracting. Now these contractions can even be spasm-like or like a cramp in the bladder. When this happens, women will feel a very strong urgency to void, and if you're not fast enough to the bathroom, to the toilet seat, the spasms in the bladder can be so strong that the closing muscle around the urethra finds it impossible to stay closed. It opens, which means that you will experience a leakage. Overactive bladder is more common the older you get. It's more common in women having given childbirth, or if you have had neurological diseases, or if you've had surgery in the area. Overactive bladder is a chronic symptom which will not go away by itself. Overactive bladder can be addressed in several different ways. The first step is often to start bladder training or urotherapy, which means that you're trying to learn the nerves to behave differently. In the next step, we may add medicines. There are several different kinds, but the point is to calm the bladder, to prevent these excessive electrical impulses and the bladder muscle as it finds it easier to relax. As a third step, you may want to use Botox, where you pass a camera into the bladder and through the camera a thin little needle, and then you inject Botox directly into the bladder muscle to make it relax. The investigation before deciding on treatment also involves to exclude other pathological processes that can exist in the bladder, for example, bladder stones. In rare cases, it can be a bladder tumor, inflammation, urinary tract infections. We also recommend that you do an ultrasound, a gynecological ultrasound or a gynecological investigation, just to look at the uterus and the ovaries, just to make sure that there are no cysts or tumors or anything else growing which may affect the bladder. Another part of the investigation will be to do a cystoscopy, where we enter the bladder with a small camera, just to make sure that there is nothing going on inside the bladder as well.